Hi, I'm Allison Hopkins, and I am the Program Coordinator for the Dental Assisting Program here at WKCTC. Today I'm going to be talking about the Dental Assisting Program, what a dental assistant does, and how to get into the program if you're interested. First thing I'd like to talk about is what does a dental assistant do in the terms of a dental team. So part of the dental team is going to be the dentist, the dental assistant, the dental hygienist, and then an office manager or a receptionist role. So all together, these people make up the dental team, whether it be a general dentist office or a specialty office like an orthodontics office, oral surgery, periodontist, pediatrics. There are multiple specialties to choose from, and those all have the same format as well. So what does a dental assistant do specifically? They work directly underneath the dentist as far as general supervision goes. That means the dentist is overseeing your work as a dental assistant. You assist chairside with the dentist on every single procedure. That could be restorative procedures like fillings, it could be extractions, root canals, any type of procedure that the patient is receiving. The dental assistant is responsible for preparing for that procedure, assisting with that procedure, and then of course talking with the patient and going over post-op instructions and things like that. The duties can vary for dental assistants depending on what state they work in. In our program, we focus on those duties that are allowed in the state of Kentucky. Expanded duties dental assistants, or EDAs, sometimes called EFDAs, are very important in the dental offices, especially locally. We do have a certification through our program, which I'll talk about soon, where you will learn how to do some expanded duties. Typically that means placing restoration, so you're going to place both tooth-colored fillings and those silver amalgam fillings as well. You can work anywhere. You can work again in a general office, a specialty office. You could work for a university. I'll talk more about our University of Louisville Paducah on-site campus as well. You could work for a sales representative such as Oral-B or Colgate. There are multiple opportunities as a dental assistant other than working just in a general office. It is a very high demand job right now. There is a great need for trained and skilled dental assistants in our area, and our graduates have 100% job placement, which we're very proud of. So more on the duties of a dental assistant. There's multiple things you're going to be doing throughout the day. Taking x-rays, taking impressions. You're going to be mixing and manipulating dental materials, going over those post-op and pre-operative instructions with your patient. A lot of patient communication and education goes into your role. You're going to be able to learn how to place fillings, polish teeth. You're going to give some oral hygiene instructions to your patient, do some fluoride treatments. The list goes on and on. A dental assistant really gets to do it all. The pictures that you're seeing now are some pictures of our students. You guys can see that they're taking some x-rays, taking impressions, polishing some teeth, and those are all skills that you're going to learn how to do within our program. So through our program, you're going to be a certified dental assistant once you pass your board exam. So what qualities do you need to be a great CDA or certified dental assistant? You need to be caring and empathetic. Your patients are going to be nervous, and you need to have that calming presence to help them feel less nervous, less anxious, and feel comfortable in your chair. You need to have attention to detail and be very organized. As I said before, you're in charge of getting the procedures ready for every single patient. It's going to be very important that you have very good organization skills and care about attention to detail. Soft skills, so being able to communicate again with your patients, but also with your dental team, to be able to call patients on the phone and feel comfortable speaking with them. The fine motor skills are very important because we're going to be using very small tools in a very small area of the mouth. So having those fine motor skills takes some practice, but it's very important to have. Definitely you need a passion for teeth. You want to be able to get excited about preventive dental care for your patients and how to prevent cavities, and be excited about oral health overall. Within our program, there's some fast facts. We accept 12 students per year. The students begin in August and graduate in May. So it is 2 semesters long. We are very proud to be one of 2 dental assisting programs in the state of Kentucky who are accredited through the Commission on Dental Accreditation through the American Dental Association. CODA is the abbreviation for that. Dental schools are also accredited by CODA. Dental hygiene schools are accredited by CODA. And again, we are only one of 2 assisting schools in the state of Kentucky who are accredited. We're very proud of that. We mentioned the selective admissions process. When you want to be in our program, you cannot just enroll and start. You have to apply. Our application deadline is always going to be April 1st of the current year. So right now, to be eligible to start the program possibly in the fall of next year, you would need to apply by April 1st of next year to be considered. Selective admissions means that it's point-based. You want to have the highest number of points possible to be competitive with those who are also applying to the program. So how are you going to get those points? That's what we need to talk about now. Your cumulative, that means all of your college class, GPA is considered. That needs to be 10 college credit hours or more. So there is a scale that we use for that you can find information about in our application packet. And it will tell you if you have a 4.0, how many points you'll receive, versus down to a 2.0, how many points you'll receive. You cannot be admitted to the program with a GPA lower than a 2.0. Your ACT score. If you've taken the ACT and gotten an 18 or higher, the points equal. So 18 on your ACT equals 18 points for the program, and it goes all the way up to the very top score. If you did not get a higher than an 18 on your ACT, you just will not receive any points for that section. The prerequisite course for our program is anatomy and physiology. You have 2 options for this. You can either take the Bio 135 with a C or higher, or Bio 137 and Bio 139. That's A&P 1 and A&P 2. That's your option, which you'd like to choose. We do recommend the Bio 135. And again, that has to be completed with a C or higher. The more points, the better. Again, you're competing with the people who are applying the same year you are. There is no magic number to get in. It's just your job to make sure you have a great GPA, get good grades in A&P, and hopefully have a great ACT score to be competitive. What you earn through our program, that really sets us apart from any other type of assisting program in the area. You're going to get 3 certifications that are embedded through our curriculum. The first one is Radiation Health and Safety. That means that legally in Kentucky you can take x-rays on your patients. The next one is called coronal polishing. If you've been to the dentist and had your teeth cleaned, they'll take that rubber cup around your teeth and polish them up. As an assistant in Kentucky, you can also learn how to do this skill, and you'll be certified through our program. The last one is the hot ticket, the expanded duties. Again, that encompasses quite a few special skills you learn through our program, but the main one people think about is placing fillings or restorations. You will learn how to be an expanded duties dental assistant through our program. You will also be eligible to sit for the Dental Assisting National Board in the spring. That is a 3-section board exam, and once you pass all 3 sections, you will then be a certified dental assistant or a CDA. From the college, you will be awarded a diploma in dental assisting. So you get a lot jam-packed into 2 semesters, which makes you very marketable. Again, I mentioned our students have a 100% job placement rate because they have all of these qualifications along with clinical externship experience, which is very valuable to dentists. Other information about how to get into our program, or once you get in, some requirements. You will have to pass a background check and a drug test prior to starting the program through our chosen vendor of Castle Branch. We have immunization requirements that you will have to be up to date on. Please note classes are 4 to 5 days a week, full days, in person. Our classes are not offered online because you need to be in person to learn those hands-on skills. They do have lecture and lab components. Attendance is very important in our program. You have to be there to learn those skills, so please note that. Clinical rotations will begin in spring. You'll be placed at 3 different dental offices to assist in a real situation. So we simulate everything in lab with mannequins and practice on our partners. And then in clinicals, you get to actually do those things in a dental office under the supervision of the dentist there. So that's a really exciting time for our students to get out in the real world. We do a lot of community involvement. One class that you have in the fall term will require over 15 hours of community projects because it's important for us to make sure that we are spreading the word of oral health and getting our students involved in the community that hopefully instills a lifelong love of oral health and learning for our students. On this slide, you can see some pictures of our students doing some community projects, volunteer work, and then also it shows how our students work hands-on to learn those skills. That's also important to why you have to be here to learn, and attendance is very important. The last part of this presentation, I'd like to let you know about our partnership with the University of Louisville Dental Clinic, the Paducah site campus here. We have a partnership to where we have a full running clinic within our area of Anderson. So that means 3rd and 4th year dental students from U of L are coming down in rotations, and you get to work with those students on real patients, doing clinical rotations and beyond, getting to experience actual hands-on dentistry, which is very exciting. So that is a recent partnership that we've had for a few years now that continues to grow, and are very excited to be able to offer that opportunity for U of L students here, but also for our WKCTC students as well, if you're interested in applying for the program. The first step is to go to our website. You can just type in dental assisting in the search bar and it will take you right to our page. My contact information is here. It's also on the website. Please just email me and I'm happy to send you an application packet. We do have pre-admission conferences once a month in September, October, November, February, and March. So you'll want to keep an eye out for those pre-admission conferences and make sure to attend one. Attendance to one is mandatory, where we review the entire application process from top to bottom. But please email me for an application and we can talk more about it, and I thank you for your time.